Something remarkable happened at the University of Colorado Boulder a few years ago. Researchers gathered a group of adults with above normal blood pressure and asked them to do something incredibly simple for just 5 minutes a day. No pills, no gym equipment, no special diet, just breathing, a specific kind of breathing. And after 6 weeks, the participants had lowered their systolic blood pressure by an average of 9 points. 9 points. That is comparable to what many common blood pressure medications achieve. The researchers were so surprised that they published their findings in the Journal of Applied Physiology. And since then, cardiologists and hypertension specialists across the country have been paying very close attention to what this study revealed. Here is what makes this even more striking. Most people living with high blood pressure have been given the same advice for years. Eat less salt, lose weight, exercise more, take your medication. And all of those things do matter. But what almost no doctor mentions, at least not during a standard 15-minute office visit, is that the way you breathe, specifically how fast and how deeply you breathe, has a direct and measurable effect on your blood pressure every single minute of every single day. 3 specific breathing techniques, each backed by peer-reviewed research, can activate your body's own natural pressure-lowering system within minutes of starting them. That is exactly what we are going to cover today. 3 breathing techniques, the real science behind why each one works, what the studies actually found, and a clear 6-week protocol you can begin using tonight. Stay with me, because the 3rd technique in particular produced results in the research that honestly surprised me when I first read the study. I'm Dr. James, and this channel exists to bring you the latest evidence-based health information designed specifically for people over 60. Every week, we dig through the research, cut through the noise, and give you practical tools you can actually use. If you haven't subscribed yet, go ahead and do that now so you don't miss what we're releasing next week. It connects directly to what we're discussing today and could be just as important. Now let's get into these techniques, because the first one is something you can begin practicing right now, sitting right where you are. Before we talk about the techniques themselves, you need to understand why breathing affects blood pressure at all. Once you understand the mechanism, these techniques will make complete sense, and you'll be far more likely to actually stick with them. Your nervous system operates in 2 major modes. The first is your sympathetic nervous system, the so-called fight or flight mode. When this system is active, your heart beats faster, your blood vessels constrict and narrow, and your blood pressure goes up. The second mode is your parasympathetic nervous system, sometimes called the rest and digest system. When this one takes over, your heart slows down, your blood vessels relax and widen, and your blood pressure drops. Here is the key thing most people have never been told. The speed and depth of your breathing is one of the most powerful controls you have for switching between these 2 modes. Fast, shallow breathing, the kind most people fall into when they're stressed, anxious, or simply busy, signals your nervous system to stay in fight or flight mode. Slow, deep, controlled breathing tells your body to shift into rest and digest. It activates something called the vagus nerve, which is the primary nerve of your parasympathetic system, and it triggers what researchers call the baroreflex, a built-in pressure regulation mechanism that your body already possesses and already knows how to use. You are not creating something new. You are activating something that has always been there. Researchers have also identified a measurement called heart rate variability, or HRV, which is the natural slight variation in time between your heartbeats. Higher heart rate variability is strongly associated with better cardiovascular health, greater arterial flexibility, and lower blood pressure. Controlled slow breathing is one of the most reliable and well-studied methods for improving HRV. And as HRV improves, blood pressure consistently tends to follow. This is not alternative medicine. This is measurable physiology documented in mainstream cardiology journals. All right, the first technique is called slow diaphragmatic breathing, and it is the foundation that makes everything else work better. A 2021 systematic review published in Frontiers in Physiology analyzed 17 separate controlled studies on slow breathing and blood pressure, and the consistent finding across all of them was this. When people breathe at a rate of approximately 6 breaths per minute, systolic blood pressure drops within minutes of starting the exercise. And with regular practice over several weeks, those reductions become sustained throughout the rest of the day as well. not just while you are sitting and breathing slowly. All day, your baseline pressure shifts downward. 6 breaths per minute works out to about 5 seconds breathing in and 5 seconds breathing out. Most adults at rest take between 12 and 20 breaths per minute. That means the average person is breathing 2 to 3 times faster than the rate that produces peak cardiovascular benefit. Your heart is being asked to work harder than it needs to, every single hour. Here is how you do it. Sit comfortably in a chair with your back supported and your feet flat on the floor. Place one hand on your chest and one hand on your belly, just below your rib cage. Breathe in slowly through your nose for a full 5 seconds. As you inhale, you should feel your belly pushing outward against your lower hand. Your chest should barely move. This is diaphragmatic breathing, meaning you are using your diaphragm, the large dome-shaped muscle directly beneath your lungs, as the primary engine of the breath rather than just expanding your chest. Then exhale slowly and completely through your mouth for 5 seconds, feeling your belly drop back down toward your spine. Many people find this feels slightly unnatural at first because most adults have developed a habit of breathing backward, pulling the belly in as they breathe in. That is chest breathing, and it is far less efficient. It keeps your sympathetic nervous system more active and your blood pressure running higher than necessary. When you breathe correctly from the diaphragm, you are filling the lower lobes of the lungs, which are more densely supplied with blood vessels and more directly connected to the pressure-lowering nerve signals that travel through the vagus nerve. A 2019 study in the journal Hypertension Research had participants with stage 1 hypertension do 15 minutes of slow diaphragmatic breathing and measured what happened. The average reduction in systolic blood pressure was 4 to 5 millimeters of mercury within that single session. Just 15 minutes. For context, a commonly prescribed low-dose blood pressure medication called amlodipine typically produces a systolic reduction of 4 to 8 points. You are reaching comparable territory with your breath alone. Comment down below and tell me your age and your most recent blood pressure reading. I genuinely want to know what our community is dealing with, because that data directly shapes the topics I cover in future videos. I read every comment. The second technique is called 4-7-8 breathing, developed by integrative physician Dr. Andrew Weil at the University of Arizona. This one is particularly useful in 2 situations. First, when you are in the middle of a stressful moment and you can feel your blood pressure spiking. Second, in the minutes right before sleep, when your overnight blood pressure pattern is being established for the next several hours. Most people do not think about nighttime blood pressure, but research from the European Heart Journal shows that people whose blood pressure stays elevated during sleep, what cardiologists call non-dippers, face significantly higher risk of stroke and heart failure than people whose pressure naturally falls at night. Getting your pressure down before you close your eyes genuinely matters for long-term heart health. The mechanics of 4-7-8 are straightforward. Breathe in through your nose for 4 seconds. Hold your breath for 7 seconds. Then exhale completely through your mouth for 8 full seconds. The extended exhale is the heart of this technique. When your exhale is longer than your inhale, you are directly stimulating the parasympathetic branch of your nervous system. The vagus nerve responds more powerfully to a prolonged exhale than to any other breathing pattern. Your heart rate slows, your vessels relax, your pressure falls. A 2020 study published in the International Journal of Environmental Research and Public Health tested this exact technique in adults with elevated blood pressure over a 4-week period of nightly practice. Systolic blood pressure dropped by an average of 6 points. Diastolic dropped by 3. And those improvements persisted through the following day, not just in the moments after the breathing exercise. But here is what I really want you to understand about why this technique works beyond the pure physiology. When you are counting to 7 while holding your breath and then counting to 8 on the exhale, you simply cannot simultaneously be running through tomorrow's worries, rehashing yesterday's argument, or calculating how many hours of sleep you might get. The counting fills that mental channel completely. Chronic, low-level psychological stress, the background hum of anxiety that many older adults carry without even recognizing it, is one of the most underappreciated and undertreated drivers of elevated blood pressure. The forced mental stillness that 4-7-8 produces is part of the medicine. I want to tell you about Harold. He is 74 years old and has been managing high blood pressure for about 8 years. His readings had been hovering around 151/93 for months, despite taking his medication faithfully and watching his sodium carefully. When we talked, he mentioned that he woke most nights around 3 in the morning, mind completely active, and would lie there for 2 hours before finally drifting off again. That pattern was generating cortisol spikes in the early morning hours that were driving his daytime pressure up. We had Harold start doing 5 cycles of 4-7-8 breathing the moment he woke at night, before reaching for his phone or the television remote. Within 4 weeks, he was sleeping through most nights. His 6-week follow-up blood pressure average had come down to 138/84. His doctor noted the improvement and told him to keep doing whatever he was doing. Now, the third technique. This is the one that genuinely surprised me, and I want to spend some extra time on the research here because the results are remarkable. It is called inspiratory muscle strength training, or IMST. And the study that put this on the map was published in the Journal of Applied Physiology out of the University of Colorado Boulder. Researchers recruited 50 adults between the ages of 50 and 79, all with above normal blood pressure readings. Half the group performed 30 resistive inhalations per day through a small handheld device that created resistance when they breathed in. They breathed in hard against that resistance. The other half did a sham protocol with no actual resistance. After 6 weeks of this 5-minute daily exercise, the results were striking. The IMST group saw their systolic blood pressure drop by an average of 9 millimeters of mercury. Large artery stiffness decreased measurably, and a measure of blood vessel flexibility called flow-mediated dilation improved by 45%. Perhaps most importantly, when the researchers checked back 3 months after the study ended, the majority of those improvements were still holding. The lead researcher on that study, Dr. Daniel Craighead, stated directly that 5 minutes per day of high-resistance inspiratory muscle strength training appeared to be as effective for blood pressure as many pharmaceutical interventions and more effective for some patients than traditional aerobic exercise. A peer-reviewed medical journal. 5 minutes per day. The mechanism behind IMST is different from the other 2 techniques. Your breathing muscles, primarily the diaphragm and the intercostal muscles between your ribs, maintain a constant, low-level connection to your sympathetic nervous system. When these muscles are deconditioned or weak, which is common in adults over 60, especially those who have been less active, they generate a persistent background of sympathetic activation simply from the effort required for normal breathing. Strengthening these muscles reduces that background noise. IMST also appears to increase nitric oxide production in the lining of blood vessels. Nitric oxide is your body's own natural vasodilator. It relaxes and widens arteries from the inside. Greater nitric oxide production directly translates to less arterial stiffness and lower blood pressure. The device used in the Colorado study is called Power Breathe, but there are other options including Aerofit and a more affordable device called the Expand a Lung. If you search for an inspiratory muscle trainer or respiratory strength training device on Amazon, you will find several choices in the $30 to $60 range. Look for one with adjustable resistance levels so you can increase the difficulty as your breathing muscles grow stronger over the weeks. Here is something important I want you to sit with for just a moment. 3 techniques. Each works through a distinct physiological pathway. Slow diaphragmatic breathing recalibrates your nervous system baseline. 4-7-8 breathing activates your vagus nerve and supports healthy sleep time pressure. IMST builds the physical strength of your breathing muscles and improves arterial flexibility. Used together in a structured way, these 3 approaches cover complementary ground. And this is where many people who struggle with blood pressure have a genuine gap in their management plan. Have you ever tried any kind of breathing practice specifically for your health before? Leave a comment and share what you tried and what happened. Your experience is genuinely useful to others in this community who are just getting started. Now, one question I want to address directly before we get to the protocol, because I know it is on your mind. Can these techniques replace blood pressure medication? I'm going to be completely straightforward with you. For some people with mild to moderate hypertension, consistent breathing practice combined with other lifestyle factors has allowed them, under a doctor's supervision, to reduce their medication over time. For others, especially those with more severe elevations or additional cardiovascular conditions. These techniques work best as a meaningful addition to medical treatment rather than a full replacement. What the research shows clearly is that these techniques work. They produce real, measurable, documented reductions. Whether they are sufficient as a standalone approach for your individual situation is a conversation that has to happen with your own physician who knows your full history. What you should absolutely not do is stop your blood pressure medication without medical guidance. A sudden spike in pressure after stopping medication can be dangerous. What you can do, starting right now, is add these techniques to your existing plan and gather your own data over 6 weeks. Then bring that data to your doctor and have an honest, informed conversation about what your numbers are showing. Here is exactly what the 6-week protocol looks like. During the first 2 weeks, focus only on slow diaphragmatic breathing. Each morning before you get out of bed, sit up with your back against the headboard and spend 10 minutes breathing at 6 breaths per minute. 5 seconds in through your nose, belly pushing outward, 5 seconds out through your mouth. Set a gentle phone timer if you need to, then repeat this in the late afternoon or early evening, anytime before dinner, just 10 minutes each time. This phase builds the habit, begins to recalibrate your nervous system, and gives you a clear baseline to measure from. Starting in week 3, add the 4-7-8 technique at bedtime. Lying in bed with the lights off, do 4 to 5 complete cycles of 4-7-8 before you allow yourself to fall asleep. In through the nose for 4, hold for 7, out through the mouth for 8. If you wake in the night feeling anxious or restless, do the 4-7-8 cycles again until you feel the calm settle over you. Some people need 3 cycles, some need 6. Follow your body. Starting in week 5, if you would like to pursue the IMST results from the Colorado research, acquire a respiratory training device and set it to the beginner resistance level described in its instructions. Perform 30 resistive inhalations each morning. The full session takes approximately 5 minutes. On days when you are ill or dealing with a respiratory infection, skip IMST and return to the belly breathing only. When you are well again, resume. Throughout all 6 weeks, check your blood pressure at the same time each morning after sitting quietly for 5 minutes. Keep a simple log in a notebook or on a notepad on your kitchen table. The date, the reading, and what you have been doing. After 6 weeks, you will have real data, your data, to show your doctor and to evaluate for yourself. A few critical safety points. If you are on blood pressure medication and you begin to feel lightheaded or notice your readings dropping consistently below 100/60, contact your doctor promptly. These techniques can genuinely work, which means your current medication doses may need to be adjusted downward. That is a good outcome, but it requires medical supervision. If you have a lung condition including COPD, asthma, or any form of pulmonary fibrosis, speak with your doctor before starting IMST. The diaphragmatic and 4-7-8 techniques are appropriate for most people, but IMST involves real respiratory effort and is not universally indicated. And if at any point you experience chest pain, heart palpitations, severe dizziness, or shortness of breath beyond normal exertion, during these exercises, stop immediately and seek medical care. Your body already has an extraordinarily sophisticated system for regulating blood pressure. Your breath is one of the most direct access points to that system. Slow diaphragmatic breathing at 6 breaths per minute activates your parasympathetic nervous system and has been shown in multiple controlled studies to reduce systolic pressure by 4 to 5 points in a single session, with greater sustained reductions after weeks of practice. 4-7-8 breathing stimulates the vagus nerve powerfully, supports healthy nighttime blood pressure patterns, and interrupts the cycle of chronic background stress that drives so much cardiovascular strain in older adults. And inspiratory muscle strength training, just 5 minutes a day, has produced 9-point systolic reductions in peer-reviewed trials that rival what we typically see from pharmaceutical intervention. These are not folk remedies or wellness trends. These are documented findings published in respected medical journals, and they are available to you tonight. Tell me in the comments what you are going to do. If you're starting the 6-week protocol, type starting today, along with your current blood pressure reading so we can track progress together as a community. If you've already experimented with breathing exercises, tell us what you found. And if someone you know is dealing with high blood pressure and hasn't heard any of this, type sharing and pass this video along to them. Getting this information to the right person might genuinely matter for their health. If this video was useful to you, please subscribe so you're here for next week's video. We're going to cover a specific mineral deficiency that is remarkably common in adults over 60, one that most doctors never test for, and the research connecting it to both blood pressure and heart rhythm is genuinely eye-opening. You will want to see that one. I'm Dr. James. Take excellent care of yourselves, and I'll see you in the next video.